All right, we're very pleased to be joined with Dr. Nekky Jamal from Wayside Dental. Now, of course, Doctor, last month was Oral Health Month. Now, we're just starting May, so for those that don't know, Oral Health Month, it focuses a lot on oral cancer because that's something that is becoming a bigger issue for me. So I guess start off from your perspective as a dentist, how important is it something that we shouldn't ignore that fact?
Oh, goodness, yeah, we always check for oral cancer whenever you come in for your checkups. So it's really important that you get checkups regularly. We recommend at least once a year so we can check all the soft tissues in your mouth and make sure there's nothing suspicious.
Now, for when most people are thinking about oral health care, they think, maybe just sore gums or gingivitis and that kind of stuff. There's a lot more to that. I guess what are some of the signs that people that can associate with oral cancer?
Yeah, it's really important that there's a lot of self-assessment that goes on throughout the year. Like if something doesn't feel right, if you notice an ulcer in your mouth or a sore that doesn't go away, if you notice a swelling that doesn't go away, any hard areas underneath your jawline, always come in and get it checked out at your dentist or even your family physician. We just want to do anything we can to help avoid any suspicious things that could occur and catch them early. Now,
one thing that I read was that even though it's the mouth is a different part, it might be separate from the body, but actually it's still kind of very functional and a major part of that when it comes to just the overall health in general.
Oh, absolutely. There's a huge oral health systemic connection. The same bacteria that in our mouth, when our gums bleed, that bacteria gets inside our bloodstream and it travels throughout our body and it settles in our heart, and that's a huge risk for heart disease and stroke. And so it's really important that we keep our mouth in great shape, not only for our mouth, but especially for our whole body, exactly what you said.
Now, another thing that I've learned as well is that early diagnosis is a big thing. Huge. Now, is that something that you as a dentist, if you do see those signs, it's good to let your patients know, like, okay, you need to maybe get a more in-depth look or closer taken care of kind of thing?
Absolutely. Like in those suspicious situations, we do recommend to do a biopsy of the area, whether that's in our office or at a specialist's office. We just want to get everyone screened and get the appropriate treatment as necessary. We just don't want oral cancer to proceed to a later stage. If there is an issue, we'd like to stop it right away.
Absolutely. And I guess just what are some of the steps that people can take towards combating it to an extent?
Sure. We need to, for all the smokers out there, we need to reduce the amount that we're smoking, and also like chewing tobacco. If we keep our overall health up, the risk of oral cancer does decrease, but it's really important to get your checkups once a year. We've found several cases in our office where we were able to treat it early and nothing really happened from it. I would just hate to see a later stage that could have been avoided by just coming and getting a routine checkup. So I do recommend everyone get their gums, their cheeks, and their whole mouth checked out.
And just to touch back, you do offer those kinds of procedures at your office?
Absolutely.
At Wayside Dental
Every single patient that comes in for a checkup and cleaning gets a full oral cancer screening, and we're so proud to offer that for all of our patients.
Well, Dr. Jamal, thank you very much for all that information. Of course, it's something we don't really think about too much, but it's something that is very possible for anybody, really.
Absolutely. Thank you so much for having me.